Good evening. I'm Dr. Ravinder Reddy, Neonatologist and Pediatrician at Medicover Women and Child Hospitals, High Tech City, Madhapur, Hyderabad. Welcome you all to this discussion. First, let me wish you all a very happy Diwali. Today, I will be discussing about World Prematurity Day and preterm babies. What is World Prematurity Day? It is celebrated on 17th of November every year to raise the awareness of preterm deliveries and how that impacts the families. Who is preterm? Every baby born before completion of 37 weeks of gestation is considered as preterm babies. Why World Prematurity Day is celebrated every year? 15 million babies are born premature every year. That means 1 in every 10 babies are born premature. Prematurity is one of the leading causes of death under 5 years of age across the world. In low income settings, half of the babies born less than 32 weeks die due to lack of basic care. Premature delivery impacts the mother, baby, and the whole family if the appropriate medical care is not offered. World Prematurity Day reminds all of us about the babies who are born too early and the health challenges they face while growing up. These babies need a lot of love, care, and affection, and the World Prematurity Day is a chance to show it. The theme for World Prematurity Day 2020 is Together for Babies Born Too Soon, Caring for the Future. This year's message focus lies on supporting the families, supporting the health professionals, and strengthening the healthcare systems. So, what are the causes of premature birth or preterm birth? In about 50% of preterm births, the actual cause and possibilities of prevention remain unknown. There are some risk factors where there is a chance of having preterm deliveries, like if the mother's blood pressure is high, or maternal diabetes, any maternal infections, or problems with uterus or cervix, consuming alcohol, smoking, or taking drugs, excessive physical work, undernutrition, obesity. Sometimes preterm deliveries can happen if there is a genetic background, successful pregnancies after assisted fertilization, short intervals between pregnancies, multiple pregnancies, that is, having twins or triplets, and so on. If the mother's age is less than 18 or more than 35 years, and if the background is from low socio-economic class. So, what is the treatment for preterm labor? In every case, obstetric colleagues try to delay the delivery or try to postpone the delivery at least 48 hours to prepare the mother and the baby. Two major types of medications can be considered. Number one, medications to reduce the uterine contractions. Number two, steroids, which can help in lung maturity of the baby. So, what happens after birth? After birth, obviously, every preterm goes to NICU, that is Neonatal Intensive Care Unit. NICU offers advanced technology as well as specialized healthcare to provide appropriate care for preterm babies and critically ill newborns. These babies stay for days, weeks, or longer, depending on the gestational age at birth and condition of the baby. Parents need appropriate time and they need to be given appropriate information, support, both social and psychological, and encouraged to cope with this difficult situation and to find their role as parents. We will look at some health conditions of preterm babies. Babies are born preterm, the less developed their organs will be. Many health conditions can result from immaturity of important organs and systems, including heart, lungs, digestive system, brain, immune system, skin, and eyes. There are some long term effects of preterm birth. Some preterm babies can suffer from lifelong effects such as cerebral palsy, mental retardation, visual and hearing impairment, poor health, and growth. Babies who are born only few weeks early what we call them as late preterms, sometimes can have long term difficulties such as behavioral problems, social and emotional problems, learning difficulties, and attention deficit hyperactivity disorder. Some children who were preterms are more likely as adults to have chronic diseases such as heart disease, high blood pressure, and diabetes. Few steps to prevent preterm births: proper advice and treatment of lifestyle disorders, of women who are pregnant or planning pregnancy, treating maternal medical conditions appropriately, treating infections appropriately, having regular checkups during pregnancy, avoid alcohol, smoking, and consuming drugs. Sometimes cervical suturing and bed rest helps. And last but not the least, giving steroid medications to the mother helps in lung maturity of the baby. Finally, the goal of the campaign is to increase the awareness around the world about the issues of preterms and helping the children survive and thrive. We at Medicover, we have 25-bed NICU with the state-of-art facilities, dedicated team of neonatologists, pediatricians, nursing team, and other supporting staff with 24 by 7 neonatal transport services. Thank you all for watching, and I wish you all a very happy Diwali.